Internal Carotid Artery Dissection. What's it all about? Let's find out. This film marks the start of a new campaign to raise awareness of a condition called an internal carotid artery dissection, to raise awareness of the condition amongst doctors and nurses and the general public all across the world. Now, the first thing to say is that we are in no way being critical of medical practitioners. This is a rare condition and one which many people may never see in their entire careers. The campaign is called I-CADAware, raising awareness of the symptoms of internal carotid artery dissections so that they may be more easily recognised. So, what exactly is an internal carotid artery dissection? So, an I-CAD, as we'll call it from now on in this film, is a tear or a lesion in one of your carotid arteries. Now, we have two carotid arteries and they run up either side of the neck and supply blood to the brain. Now, if the inner lining of the wall of one of the arteries tears away, then that leaves a gap where blood can flow in between and then cause a bulge in the outer lining of the artery. This lesion and this bulge can then slow the flow of blood through to the brain, or it can block it off entirely. The other issue is that it can cause damage to the nerves and tissue around this area as well. A tear can also trigger the body's clotting mechanism. Sometimes a piece of a blood clot can break off and block one of the smaller branches of the artery entirely, slowing blood flow to the brain and possibly causing a stroke. I-CADs are also more predominant in younger people, people under the age of 40, who are generally fit and active, and they tend to occur more often in women rather than men. 20% of all strokes in younger people are caused by I-CADs.
What caused my spontaneous carotid artery dissections? Well, it's either my horrible genetic pool with the genetic disorder of Ehlers-Danlos classical type 1. One of the last things was I've had quite a few concussions from my head meeting other people's fists in bar fights when I was in the military, and also my experience dealing with disposing of a lot of ordnance and blowing up stuff for fun, and those could have caused underlying issues and just made me maybe trauma prone to have these.
I suffered my first CAD in my left carotid artery during an intense CrossFit workout. My initial symptoms were intense, painful migraine, dizziness, loss of peripheral vision, and an overall feeling of not being present in my own body. I knew something was wrong and made an appointment with my primary care physician's office midweek. I was ordered medication for migraines, but no imaging.
So, what actually causes an I-CAD? Well, usually it's down to some form of neck injury, for example, a car accident. But it usually involves some form of neck rotation or extension. However, some dissections appear spontaneously, and the patient may not know that anything's happened at all. As I say, it's usually as a result of some form of physical activity.
I do a lot of running and cycling in my spare time. I was riding my bike when I got a tearing pain in the left side of my jaw, which spread up to my ear and head. I also had blurry vision for about 30 seconds, with a very bad headache and pulsatile tinnitus every time I stood up or turned my head. I went home, said to my partner, also a doctor, well, maybe it's a carotid artery dissection. Well, we both laughed it off. I put it down to a middle ear infection and went to bed. The next day I told my boss about my headache and he sent me to A&E. There I was seen by a consultant who said that I probably had a middle ear infection, but to be on the safe side he would arrange a scan. I had a CT angiogram, which in the end did in fact confirm the CAD diagnosis.
So, what form of physical activity are we talking about here? Well, usually it involves some form of sports. One of the most common occurrences is in the gym. Pumping iron, lifting heavy weights, putting the blood pressure in the body under extreme strain. The same thing can happen using a rowing machine or whatever. Many people report that they've suffered a dissection as a result of cycling. Now, every time you turn your head to see what's going on behind you. Swimming is another common example. Every time you turn your head to one side, again and again and again to take a breath, I really must be more careful. Scuba diving, another example. The changes in air pressure can do strange things to the arteries. Any form of sport such as football, volleyball, basketball, they can all cause I-CADs. Some people have reported having I-CADs as a result of doing yoga. Maybe it's the standing on the head routines. I don't do yoga myself. Being on a roller coaster, any kind of fairground ride that puts the neck under stress. One more common way of getting an I-CAD these days is as a result of having treatment by a chiropractor or an osteopath. The manipulation of the neck and the crunching and so on to help free up vertebrae can do some very strange things to the arteries.
So I had the MRI and I was left in the day room till about 11 o'clock when my husband went and asked if we could leave the hospital. He was told by a doctor that they would come and speak to us shortly. When the doctor came, he actually said to me, "You can't leave the hospital because you could drop dead at any moment," to which I passed out, and then a bed was found for me. Didn't fully understand anything until the following morning.
People often say that they have spontaneous CADs for absolutely no reason at all. So when they present in front of the doctor and they're asked the questions, have you done anything that may have caused this problem? There's nothing at all. In fact, an I-CAD can occur through any physical activity whatsoever. Throwing yourselves around, even sneezing can cause an I-CAD. So, now we come to the most important part of the film. What are the all-important symptoms of an I-CAD? Well, some people may present at their doctor showing no symptoms at all. Very difficult for any medical practitioner to diagnose there. But most people are showing something, and usually these are very common symptoms if only you know what to look for. Most of the symptoms occur over a period of a few days, but sometimes they do come on suddenly, just like that. Let's have a look at what some of these symptoms actually are. The classic symptoms are blinding headaches. Headaches like you've never had them before, even if you've suffered previously from migraines. Sometimes these headaches are mistaken for cluster headaches, also known as suicide headaches, and you can guess why. Believe me, these headaches make you want to cry, make you climb the walls, and make you want to put a gun to your temple, an area which is often the focus of the pain. Next we have Horner's syndrome. One eye with a droopy lid and a small constricted pupil. Cluster headaches are often accompanied by Horner's syndrome and vice versa, and are sometimes a cause of misdiagnosis of an I-CAD. Scalp pain, often right on top of the head, a pain so severe you cannot even rest your head on a pillow. Eye pain, so acute it feels like your eye is about to burst out of its socket. Faux sinusitis, a pain in the sinus region, often mistaken for a sinus infection. Of course, there will be neck pain,
Pulsatile tinnitus,
and maybe a weakness or numbness on one side of the body.
So my symptoms, I had the mother of all headaches to the point I was vomiting with pain. I had dizziness, I had blurred vision, I had really bad Horner's. I mean, you know, what were the GPs thinking? I had semi-paralysis down the left side, it was hard to lift my hand. You know, I felt like I was dragging my left side. I had extreme fatigue. I was losing words. So I had the full raft of symptoms in abundance.
Now this is where we have a problem. On the largest I-CAD support forum, of which I am a member, we're constantly seeing posts from people from all over the globe who are getting misdiagnosis or no diagnosis at all from medical practitioners who just don't recognise the symptoms. Now this isn't their problem. After all, it is a rare condition. We understand that. But far too often, patients are being sent away with a diagnosis of it's a migraine, or it's sinusitis, or you're suffering from an allergy of some kind. And they're packed off home with nothing more than a box of paracetamol. Now we don't blame doctors for this. We understand that it is a rare condition. But when they come across the symptoms, which as we've outlined are very obvious, we need to get that message across. Even where doctors recognise that there is something more happening and they order up some scans, maybe CTs or MRIs. All too often, those scans are done on the head to make sure that the patient hasn't had a stroke. But what they don't do is then scan the neck to see if there's anything happening there. Because of course, a stroke could be just down the road.
So, you know, my kind of takeaway is to advocate for yourself because no one else is going to do it for you. You know, a lot of people who are in my position find out they have a dissection after they have a stroke, which was going to be the next probably step for me. So I'm about 3 weeks out from my hospital stay. I was in the hospital for 3 days on heparin, which is a blood thinner to try to, you know, I guess control the blood clot. And now I'm on blood thinners and pain meds. I still have pretty severe headaches. I have what they call Horner's syndrome, so my eye kind of gets droopy.
24th of December 2017. Woke up in agony. Had severe head pain. In all my life I can't remember ever having a headache. Went back to bed in agony. 28th of December, my tongue had now swollen to the point it was starting to block my airways. 10 a.m, now struggling to breathe, I drove myself to my local hospital A&E. The consultant took one look at me and said it was an angioedema. He prescribed a stronger dose of antihistamines and codeine for the pain and said I should be okay in a few days. Obviously I wasn't.
For those people in the carotid artery community, it's really important that more doctors become aware of the possibility that the person presenting before them with the symptoms we have outlined hasn't just got a bad headache. They may well have suffered an internal carotid artery dissection, which if not treated quickly could lead to further complications and even a stroke. Fast intervention with blood thinners and anticoagulants can save people an awful lot of pain and disability. And the first-hand experience of a lot of I-CAD sufferers tells us a lot of what we need to know.
You know, like a lot of other people in the dissection group, the awareness of the ongoing symptoms, it just seems to be quite low amongst doctors or specialists, and you feel quite lonely, you feel quite vulnerable trying to deal with symptoms that doctors don't recognize and that you're trying to explain to people. And it is, yeah, I find that really, really hard. But I have to say I'm incredibly thankful that I'm alive, and I'm also so grateful for the support of all the people in the Dissection Facebook group, because they have just been amazing throughout.
You know, you would think there are some really clear symptoms. I think lots of us have Horner's. Horner's is a real clear indicator that something is wrong, which is why many of us have opticians diagnose for us. So first off is, you know, Horner's. I think the discrepancy between resting pulse and blood pressure, it's not everyone, because I know yours wasn't that. But that is a clear indicator of a bleed somewhere in the head, possibly the brain.
Chris wants to know if the medical personnel recognized my symptoms. Not a single doctor, including both at urgent care in a civilian hospital and in the Veterans Administration hospital system. They kept insisting that I was having either eye strain or migraines or a sinus infection or sinus issues. And it wasn't until I had that MRI approximately 50 days later from the start when they actually saw that it wasn't any of those.
It was only when I noticed that my right eyelid was swollen and the tissue around my eye cavity was inflamed that I made an urgent appointment with my GP. She thought I had an eye infection. The consultant examined me for a good 30 minutes but couldn't find anything wrong with my eye. I didn't realise at this stage, but already had a carotid artery dissection with full occlusion and blood clot, a stroke, nerve damage to my face and Horner's syndrome. I asked him what he thought it was, and he just said neurological something. The acute GP said she knew something was wrong, but the symptoms weren't making sense. I asked her to level with me, and she said it could be MS, a brain tumour, or Bell's palsy.
I could have had a stroke and harmed myself or others from poor diagnosis and poor communication. And I hope that what doctors take away from my experience is that a headache isn't always just a headache. That's not necessarily a diagnosis. It might just be a symptom of something else. And to look at the constellation of symptoms that somebody is offering and look for what that could all be.
I left that appointment in tears, knowing that something was wrong, even though I was told by the physician assistant that it was only a severe migraine. My husband and another family member in the medical field advocated for me to go directly to the emergency room. Imaging confirmed a left carotid artery dissection and complete stenosis of the artery, meaning absolutely no blood flow to my brain in that carotid artery.
And as for my part in all of this, well, I had my dissection in 2018. I paid 7 visits to my local GP surgery and saw 7 different locums, none of whom had a clue what they were looking at. One did suggest clutter headaches, but didn't know anything about them at all. I paid 5 visits to my local emergency department at the hospital, once in an ambulance, twice I was put on oxygen, but again, nobody had any idea of what was going on. Someone did a scan of my head on the first visit just to check I hadn't had a stroke, but I hadn't, and I knew that. Eventually I went to Specsavers to have a look at my eye because I had a droopy eye, and she suggested that I might have Horner's syndrome and I should go to the eye hospital to get that checked. Eventually I paid privately to go to see a neurologist and have an MRI done, and he finally diagnosed the CAD, and I was instantly put on a Pixaban to thin the blood, and I found a painkiller that would work. So after 2 months of severe head pain, 24/7, finally I got my condition under control. I think I'll leave the last word on this to Rose.
It's also about listening to the patient. You know, I think most of us who've been through this knew something was wrong, which is why we went back to the doctor 9 times. You know, we weren't wasting the NHS's time. We were actually in severe pain and frightened and, you know, aware that something was fundamentally not right. And it's getting the doctors first to take you seriously and then to really see the picture. But how we get that information to them, I don't know. I think it'd be worth asking some GPs how they would like that information and what would help them.